Hi, I'm Randy with Triam AI out of Boone, Iowa. And this PowerPoint presentation is a PowerPoint that I've presented to producers on measuring backfat in gestating sows. Ultrasound in gestating sows for backfat. For the producer wanting to add more pigs per sow per year, one of the best tools is to use an image type ultrasound. The goal has always been keeping the whole herd in optimal breeding condition. Many genetic companies have found that keeping gestating sows between 16 and 20 millimeters of back fat at the last rib keeps the sows in optimal breeding condition. This chart here is a performance comparison of two groups of sows. The first group shows a percentage of below the 16 millimeters of back fat. The second group, a percentage above. Now, the difference on the third column is pretty easy to follow. When I'm using this comparison, I've used a lot of different comparisons similar to this that show the same results. What I've chosen out of this list at the bottom of this chart is the farrowing interval of 3 days. Just as an example, 3 days versus 1,000 sows times 2.3 farrowings a year and 6 pounds of feed average gives you a pretty good comparison of what corn and soybean costs were several years ago and what they are now. Each one of these comparisons you could put a dollar figure to. The concept of scoring sows' condition is nothing new, nor is the use of back fat measurements. Many producers have seen this chart. It relates to scoring sows in the barn from the very thin sow to the very fat sow and adjusting feed accordingly. The concept of scoring sows 1, 2, 3, 4, or 5 can be used in this cartoon example, and the point here is that the human intervention comes into play when one person calls the sow a 3 and the next person calls it a 4, etc. That can be eliminated by the use of ultrasound. The use of backfat measuring tools is nothing new. The two most prominent kind of ultrasound is type A ultrasound, which is a non-image type, and a type B ultrasound, which is an image type. Both use the concept in ultrasound of the sound wave. The type A gives you just a reading. The type B actually gives you a two-dimensional image. This is a good example of a type A ultrasound, a non-image tool that uses the sound principle of echo back into the unit and gives you a particular reading, a particular number. Use of a type B ultrasound, when using the probe, the user in the barn can lay the probe on the animal's back and the image comes back into the handheld unit. Our model, the VetScan model, is such a unit. This picture shows that finding the last rib and laying the probe just 2 inches to the right or left of the center of the spine. Here's an excellent example of the new technology in the newer machines of a linear image. Clearly one can see the 3 layers of fat, can see the loin muscle, can actually see the intermuscular fat within the loin muscle, and the bottom you can see the 2 ribs, second to the last and the last rib. This is what's so important today compared to the technology that we've had in the past. In the past, we could not see the last rib in the small handheld units. We could only see that when using a higher-end medical-grade, hospital-grade type unit. This is a good example of using an array probe, which is different from the linear probe in the last slide. One can clearly see the layers of back fat at the bottom. One can just barely see the 2 white lines, which would be the last and second to last rib. Proper positioning of the probe in this picture shows that the rib cage on a sow, getting the gray square is where the probe would be laid to find that proper point of taking an image. Protocols have changed, but one of the most used protocols that I've seen over the years in different farms for taking the measurements, there have been several, but this is probably the most prominent. The first being taking a first measurement at the beginning of farrowing, the second measurement at the end of farrowing, and then 3 during gestation. In the past, it's always been common to take that measurement at 30, 60, and 90 days in gestation. Along with that, one would use a cloth-type tape measure to estimate the weight. This is done by taking the measurement from flank over the back of the sow to the other flank. The other part of the protocol for determining the amount of feed to be fed to the sows is a feed chart, and that gives you the direction to increase or decrease the amount of feed. Protocols that we have seen in the last couple of years have changed it from 5 or 6 measurements down to 2 measurements. First of all, they start a history by taking a measurement in the gilt pool. And then during the time of the sows, the different parities through the life of the sow in the barn, one measurement is taken at weaning, the day of weaning the piglets off the sow, and the other at 50 days post-breeding. Now, there are variations of this protocol, but this is probably the most common one seen in the last couple of years. Again, we take an estimate of the weight on farms also. Now they're relying also on the metabolism or combination of both. And again, the use of the feed chart to increase or decrease feed. Here's a good example of a university feed chart when using backfat measurements. It shows that taking that measurement from flank to flank to get that estimated weight, the backfat measurements, and then the numbers in colors are examples of what amount of feed should be fed to the sow. If one would take a 500-pound sow that had a measurement between 12 and 14, one would see that this chart shows 7 pounds of feed to be fed to that sow. Now, this is just an example. If this was a 15% gestation ration using 7 pounds and an alternative feed ration which was say 15.5%, then that 7 would be whatever adjusted number. In the past, the small handheld ultrasound models have been analog with sector probes with the use of gel standoffs. Now, these were adequate, but they were often hard to determine the exact location of the backfat line and where to begin and to stop the measurement on the image. The other models that were used from the human medical side and were used with large linear probes for carcass evaluation. This is a good example of using a sector probe with a gel standoff. One can see by the lines pointing to the layers of backfat where this was. This was hard to determine when it was in real time, when they're actually working in the barn, taking this measurement from the sow. This would be in motion. And although we can freeze the image, it was difficult to determine exactly where we were at. Here's an older image of a linear image. Again, we can see the lines of backfat, but cannot see where the loin muscle and ribs are indicated. Today's models, including the VetScan, are lightweight portable units, have gone from analog to digital scanning technology, and the use of probes now are either convex array and or linear. Again, the photograph showing the use of a linear probe. The technology in this is digital and gives a far better image than what the old past models had. Again, the linear image showing this. The most important part of this advancement is from the higher end units that we could see the last rib compared to what we've had in the past is the key of this presentation. This last rib, as you can see on this image, if you go from the last rib and go to the layers of backfat, you can see the difference between the thickness of the backfat at the last rib compared to the second to the last rib. Again, with using type A ultrasound where there's no image, it's hard to indicate where exactly you've been at. This is a great increase in accuracy. It also allows anyone who can take these images the same reading as anyone else. This photo shows an array probe. The array probe is similar to the linear, only it's in a curvature type image. Again, it uses digital technology that we didn't have in the past in these small portable units. This array probe, again, shows those layers of backfat, and at the bottom, the 2 white lines about a ½ inch up from the bottom of the image shows ribs. Seeing is believing. As I stated earlier, this is the constant of this presentation. Being consistent, being able to take a measurement in the exact same location each time. Over the years, I've seen producers, farms that started using either the sector probe or type A ultrasound, and their readings were not consistent because they could not go back to that same exact location each time. Now we can do that with a small portable unit and get the same reading no matter who is doing it on the same sow. Being consistent with using type B ultrasound will achieve that same goal that we're looking for in the optimal breeding herd, keeping that sow herd between 16 and 20 millimeters of back fat.